Good afternoon, Miss. I am Arsenvine. I am Caban from Bsn-Ii Wiedenbach. Bag technique is a tool making use of a community health bag through which the nurse, during his or her home visit, can perform nursing procedures with ease and deftness, saving time and effort, with the end result of rendering effective nursing care. Community health bag is an essential and indispensable equipment of the community health nurse, which she has to carry along with her when she goes out for a home visit. It is composed of basic articles which are necessary in giving nursing care. Purpose: to render effective nursing care during a home visit in the community. Special considerations: the bag should contain all the necessary articles, supplies, and equipment which may be used to answer emergency needs. The bag and its contents must be cleaned as often as possible, supplies replaced, and ready for use at any time. The bag and its contents must be well protected from contact with any article in the home of patients. Consider the bag and its contents as clean and sterile, while any article belonging to the patient as dirty and contaminated. The arrangement of the contents of the bag is the one which is the most convenient for the user to facilitate efficiency and avoid confusion. Hand washing is done as frequently as which the situation calls for, since it helps to minimize and avoid contamination of the bag and its contents. Equipments: plastic lining, paper lining, waste receptacle, soap dish with soap, cotton applicators, 4x4 sterile gauze, bandage scissor, towel, betadine solution, plaster, apron, sterile gloves, and 70% ethyl alcohol. Upon the arrival at the patient's home, the bag should be placed on top of the table, lined with a clean paper and plastic lining. The clean side should be out and the folded part should touch the table to prevent the bag and its contents from contamination. Put the bag on the left corner of the table and tuck the handles or straps beneath it. If a faucet is not available, ask for a basin of water or a glass of drinking water in case tap water is not available. It is used for hand washing or cleaning the thermometer in case a thermometer technique is used. Put them outside the work area to prevent the workspace from getting wet. Open the bag and take out the towel and soap to prepare for hand washing. Wash hands with soap and water. Wipe to dry to prevent contamination. Take out the apron from the bag and put it on with the right side out to protect the nurse's uniform and create an aesthetic appearance. out all the necessary articles needed for the specific care to make them readily accessible. Close the bag and put it in one corner of the working area to prevent the contents of the bag from possible contamination. Proceed in performing the necessary nursing care and treatment to provide the necessary treatment needed by the client. After giving the treatment, clean all the things that were used and perform hand washing to prevent the contents of the bag from possible contamination as well as protecting the nurse from contamination. Open the bag and return all the things that were used after cleaning them to prevent the spread of microorganisms. Remove the apron. Folding it away from the person, the soiled side in and the clean side out. Place it inside the bag to prevent the spread of microorganisms. Fold the lining. Place it inside the bag. And close the bag. To protect the bag and its contents from contamination. Take the record and make a post-conference visit on matters relevant to healthcare. Record all significant findings for reference for future visits and make an appointment for the next visit, taking note of the date and time for following up care.